Hi, I'm Dr. Drew Ramsey. Welcome back to the Brain Food Vlog. I'm an assistant clinical professor of psychiatry at Columbia University and on the editorial board at Medscape Psychiatry. Let's check in about Zoom-side manner. Everyone saw the CDC data talking about how much we're all going to be in demand, with 40% of Americans reporting concerns about their mental health, and most concerningly, 11% of Americans actively or seriously considering suicide in June. So we're going to have to be as good or better than we've ever been before. When we started quarantine in COVID, I released a video encouraging you to really engage in telepsychiatry because we had to, but also this challenge of could we be better? We've always had this bias, it's not as good. Now, I had some tips in there that we can all admit weren't great. I said, use noise cancellation headphones. I had these nice, headphones. And then, after a few months, my ears started to hurt. Maybe your ears aren't as big as mine. But I think we've all kind of adapted as we've spent hundreds, if not thousands of hours seeing patients clinically. So I wanted to talk about a couple of my observations, and I hope in the comments below you'll leave some of yours. So let's talk about Zoom-side manner. In some ways, being a physician and a psychiatrist is what it always has been. Be a good doctor. Listen, give positive feedback to your patients, actively listen, do what we do in psychiatry. As I said, I wondered whether we could do it better. I think that one part of Zoom-side manner that's different than bedside manner is we need more and different types of self-care as clinicians. There's so much that we've lost in terms of engaging with colleagues, or if you're in a hospital, just getting a quick curbside. That's just different now, as we are all in what I've been calling my Zoom cage. And so I found that self-care and taking breaks is much more important, especially from screen, is a bio break for the first time, and understood that you can really sit right here I have for hours and hours, just like you have, and not engage in good self-care. So whatever that means to you, do more of it. For me, my transition, I'd ride from my office back to my house on my bike, and it was a time for me to, just process a lot, to be with myself. Now I can finish a really emotional and deep session and walk out this door, and there's my family or wife, kids, time to make dinner, whatever it is. And so I found that to be really challenging. I don't know how all of you are dealing with that, but I've really tried to put in some transitions. Maybe that just means getting to my Zoom cage a little earlier to give myself a little time to settle in. Certainly making sure to go outside in a more intentional way. So those are all, I think, just important ideas to consider. How are you going to transition, and how do you take good care of yourself, take those bio breaks? I think there are a lot of pros to this format. I've seen lots of pets. There's something around an intimacy that we've lost sitting with a patient, but there's also something around intimacy that we've really gained in terms of being inside someone's home. Or I saw a patient who was on a road trip and sitting in the car that she'd purchased, major treatment goal, her first car. So there's awful moments that I think are getting created in this Zoom or digital format that we should really pay attention to. I've had group meetings where 2 or 3 therapists have met with an entire family, and it was so kind of easy to arrange. It made me wonder, why hadn't I done that before using telemedicine? And then, of course, the other pro is the efficiency. There's no time for travel. Patients can come and see us. The barrier to see someone for evaluation in some ways is much lower. There's more anonymity, and there's really not a barrier that there was in terms of getting to someone's office, feeling that stigma maybe of seeing a mental health professional. And then for us as clinicians, of course, just not needing to go anywhere. Again, some pros and some cons of that. And certainly, on the con side, I think there is the fatigue that we feel as clinicians, some of the isolation that happens as a clinician. And as a final point, I wanted to talk about boundaries. Boundaries are something that's so important to us in psychiatry and in mental health, how we allow patients to be very personally connected with us, and at the same time not to share too much about ourselves. That's really changed as we're all in a collective trauma together, both dealing with COVID, with quarantine, with what's happening in terms of racial inequality, systemic racism, and then also the multiple high-profile murders by police officers in America of Black men and women. That's all brewing around and making it, in some ways, very challenging to keep boundaries. What I found is helpful is to be consistent in my location, to really, as I said earlier, work on that transitioning into my frame of mind of doing work and being a psychiatrist. I think it's important to orient patients to our protocols more of who's calling who. I've done a better job of that sometimes, of how you're going to communicate with patients if there are issues. Do you text? Do you call? Especially during how your intake and evaluation process has evolved or changed. Just really being clear with patients, however you communicate with them initially, and what those first steps are to becoming your patient. I think that's a new part of Zoomside Manor. And then I guess the last piece is just not to get loose, which I think is hard. This is like a super weird thing that we're all in. We're all involved in a much more personal way. We're seeing patients in a more kind of personal light, this almost voyeuristic way that it's not just we're hearing about your life, we're actually inside and seeing it at times. And then we're talking about COVID together, which again, I think brings us much closer and creates alliance with our patients. I just think it also is something that we have to watch in terms of getting a little bit loose, especially as we're more socially deprived. Those are some thoughts I have on your Zoomside Manor, but mostly I wanted to post a video to say, hey, hang in there. We're in this together. America needs psychiatrists and mental health professionals like never before. And I think the more we can support each other and the more we can communicate about the new challenges, some of the opportunities, and what's ahead of us, the better we're going to do. I'm Dr. Drew Ramsey. Thanks for hanging out with me a little bit here at the Brain Food Vlog. If there are any thoughts you have about how to have a better Zoomside Manor that you want to add to the conversation, please drop it in the comments below. Thanks.